Hi, my name is Erin Thomason. I chose to do substance use and misuse for our individual presentations. So on our agenda, what we're going to go over is what is addiction, when does it become a problem, the levels of care, the evidence-based clinical interventions that might work with somebody who is experiencing addiction, stages of recovery, or stages of change in recovery. Um, and then we'll go over I have some videos for lived experiences that you can choose to go look at or not look at. But they're good videos. They are real people being recorded from interviews, and it's a YouTube page called Soft White Underbelly. I've followed it for a while now, but um, it's this guy out of LA that interviews people that are living on Skid Row or interview people of interest to others and whatnot. He oftentimes helps them as well. So, like, there's an ethical part to it. After he does the interview, he'll help them out with different things. But they're good to watch because you can see the temperament and like live, real life people that are experiencing addiction and different mental health disorders. So first off, we have what is addiction. Just a second here. So addiction forms when an individual who utilizes alcohol and substance use continue to use despite the continued negative consequences within their lives. So that's the key part in addiction is when people start to experience like a part of like negative consequences in their life, but they continue to use despite these negative consequences, that's when we start to have a problem. People can experience negative consequences, like losing their family members or losing the trust of other individuals. Sometimes they get in legal trouble, and I want to talk about that more about um, the ASAM when I get it's on the other half of the slide here, but we'll go over that here in a minute in more detail. So addiction is when your life becomes unmanageable. So typically addiction is when the substance or um, thing that you're addicted to it takes over your life and you're unable to manage it on your own, leading to negative consequences. Um, so there's a bunch of different types of addictions, right? There are all kinds of addictions, not just substances, but people can be addicted to pornography. People can be addicted to food. People can be addicted to um, behaviors. People can be addicted to all kinds of things. I have not personally seen too many strange ones, but I mean, there is a show out there called My Strange Addictions. So you can let your imagination go with that. But there are all types of addictions. So, like I said, when does it become a problem? It becomes a problem when it starts affecting these core areas of your life. I don't know if you can see my um, cursor here, but I'm circling on the left side of the page the 1 through 6. These are the indicators that this has become a problem in your life. So we'll go over that really quick. Um, when you come in to do a substance use evaluation, oftentimes the substance use counselor will use a thing or a tool called the ASAM, and that is to measure how far you are into your addiction. What is your addiction affecting in your life? And these are the core things that addiction typically affects. So the first one you're going to check for acute intoxication or withdrawal. Are they having withdrawal symptoms from the substances you're using? We'll use alcohol for example. Are they having shakes? Are they having tremors? All of those things are acute intoxication and withdrawal. So if they're having that, then we put like a yes next to that, number one. So the more yeses you have, or the more of these that you can answer yes to, the worse your addiction is. basically. So are you having biomedical conditions? Is their liver failing? Do they have cirrhosis? Are they having, I mean, all kinds of issues, but it has to be biomedical conditions. So your health, your organs, um, are you having seizures? All of those types of things. The emotional, behavioral, and cognitive conditions and complications. Um, this is like when you are experiencing maybe psychosis because of your drug use or alcohol use. Are you experiencing changes in your emotions? Is it impairing your cognitive ability? Those kinds of things. And that like emotional behavior and cognitive conditions can also be, is it affecting your relationships with others? Are you having issues with your family, um, your loved ones, that kind of thing? Have you lost your job because of using or drinking? Have you experienced any legal issues because of your drinking or using? And then you go to readiness to change. We kind of determine, are they in the which stage of the change is this person in? We'll go over the different stages of change later. And then we have number 5, relapse, continued use, or continued potential or problem potential. So how high is the risk for them to relapse or continue using? Where are their supports? Do they have supports to help them from or keep them from relapsing, that kind of thing? And then 6 is recovery and living environment. What is their, are they homeless? Are they living in a house that they're being enabled? Are they living in a house where there's other people using drugs and alcohol? That's also very important to know, because typically they say when people go to recovery, they don't want them to go back to the same playground that they used to be at before. Therefore, the people in the place and everything's the same. They're just trying to stay sober this time, and typically that's not ideal. They end up using again or relapsing. All right, levels of care. Sometimes the level of care determines the interventions used. So just keep that in mind. Okay, so there are 7 total different levels of care when it comes to substance use. As you can see off here to the right, we have early intervention, outpatient treatment, intensive outpatient program, partial hospitalization programs, residential and inpatient treatment, intensive residential treatment, and medically managed intensive inpatient treatment. And they all have different levels attached to them. You can see off there to the right. So we'll go over early intervention quick. Early intervention, this is typically like your education. This is when you can potentially see an addiction or an issue in the future or in the near future. So you're gonna basically, there's brief interventions or education aimed at preventing further substance use or identifying early signs of addiction. The target audience are individuals who are using substances in a way that could lead to a problem but don't know that they meet criteria for a full substance use disorder yet. So this is, I want to say like your uh, your early intervention, your DUI classes, things like that. Outpatient treatment. Um, so the people that we are targeting, or that we would like to, the target audience is individuals with less severe addiction who have a stable living environment and strong supports. So outpatient treatment often includes services like individual counseling, group therapy, psychoeducation, and support groups, such as like 12-step programs and things like that. Outpatient treatment allows individuals to live at home while receiving therapy and counseling. It typically involves less intensive services than outpatient or than inpatient care. So this is like your Heartland Counseling, your Jackson Recovery Center, some parts of Rosecrans Jackson Centers, not all, and your Siouxland Mental Health. These are all outpatient treatment level 1 recovery centers. So the intensive outpatient program, this is your IOP. So these are the groups that people come to at night, right? Typically, these people come to an outpatient setting around 6 or 7 o'clock at night. They'll come in, they'll sit in group for 4 days a week, sometimes 5, for like 3 hours at a time, and they do. It's like a more frequent individual and group therapy session, usually 3 to 5 days per week. You learn about skills trainings and you focus on relapse prevention, coping skills, and support for maintaining sobriety. So then your partial hospitalization program would be a step between outpatient and inpatient treatment. PHP involves a more intensive schedule, but patients return home at night. So this is things like daily therapy, individuals and groups, medical monitoring, psychiatric care and counseling, and substance use education. So our target audience for this level of care would be individuals who need intensive treatment and support, but can maintain a degree of independence and are stable enough to live at home. Okay, next is residential and inpatient treatment level 3. So again, this can be like your Rosecrans Jackson Centers. They have an inpatient program over there. And then, so our target audience for this level of care are individuals with severe substance use disorders and those who have failed to succeed in outpatient care. This level is also appropriate for individuals who need detox or have co-occurring mental disorders. So typically, if people are continuously failing UAs, that stands for urinary analysis, in an outpatient setting, and they're experiencing more issues, even though they are attending outpatient services, typically we'll look into doing one of these referrals for inpatient treatment. So number 6 is intensive residential treatment, level 3.5. This is a more intense residential treatment program that offers a higher level of medical and psychological care than traditional inpatient treatment. It often includes specialized treatment for those with co-occurring mental disorders and complex medical needs. So believe it or not, there are still residential treatment facilities today that will not take people because of their severe mental illness. And it irks me because typically the two go hand in hand, right? You don't typically see somebody with a substance use disorder that isn't experiencing or has experienced trauma or some kind of mental health disorder. So it is strange that we still work that way in 2025, but that's the reality of it. Anyway, so the intensive residential treatment, our target audience are individuals with complex and severe substance use disorders who require a more intensive medical or psychological interventions. So this is 24/7 care and supervision, therapeutic services, including individual and group therapy, medical monitoring, and socialized care for co-occurring. Co-occurring is the key word here. Mental health disorders. And then last, we have the medically managed intensive inpatient treatment. This is for individuals with very severe addiction and those who require stabilization and detox in a hospital-like setting due to medical complications. So this is the highest level of care. This is designed for individuals with life-threatening substance use disorders who require 24/7 care in a medical facility. So the services provided in this level of care are medical detox, intensive psychiatric and medical care, 24/7 monitoring, and treatment for co-occurring medical and psychiatric conditions. Okay, so let's get more specific about the interventions that we would use with people that are in a struggling with addiction or have a substance use disorder. All right, so the interventions, right? So typically we can use CBT with people that are struggling with addiction. You can use this in an individual, outpatient, and inpatient therapy. Um, you can use motivational interviewing. This is for both individuals for outpatient and inpatient therapy. I have seen the um, acceptance commitment therapy used in IOP groups. Um, and then often there is family therapy in inpatient settings. So they'll have a day where the family comes and they kind of talk about what happened and their issues, and um, they get to hash things out kind of while the individual is in inpatient therapy. So group therapy, this was created by a man named Bill Wilson. AA was founded in 1935. There was also, it was Bill Wilson and Dr. Bob Smith, both of whom were recovering alcoholics. The organization was created as a way to provide mutual support to individuals who were trying to stop drinking, offering a fellowship where members could share their experiences and support each other in recovery. The AA approach emphasizes the importance of admitting powerlessness over alcohol, surrendering to a higher power, and working through the 12-step programs of recovery. So typically, um, group therapy is used in inpatient or IOP, that extensive outpatient program we talked about earlier. A lot, not everybody, but most substance use follow the AA or the NA criteria. Um, So NA is Narcotics Anonymous. It was founded in 1953 with a similar structure to AA, focusing on helping individuals struggling with addiction to drugs. So the difference is one is alcohol and the other one is drugs. Um, Other 12-step programs were created over time for various substances, including cocaine, marijuana, and Gamblers Anonymous. Um, So these groups, they typically offer a sense of community, accountability, and mutual support, which can be critical for individuals who are trying to overcome addiction. One of the steps in the 12-step program is admitting that you're powerless over alcohol or the drugs. That's the first step. And then, I mean, you can't be addiction alone. You need a support group, and typically these offer that. There's people in there struggling with the same things you are, and that sense of community is truly critical in helping an individual recover. Um, so then we also have. I just want to mention real quick. I struggle to say the name. I don't know why I've always struggled to say it, but there are support groups for other individuals that were affected by somebody who they love who was struggling with drugs or alcohol. Um, like they do say that alcoholism is a family disease, right? So it's not just that individual that's doing the drinking that's affected by their disease, but the entire family as a unit. And there is a support group called Al-Anon. It's a support group specifically designed for families and friends of individuals who struggle with alcohol addiction. It was founded in 1951 by Marie Wilson, who was actually the wife of Bill Wilson, the co-founder of Alcoholics Anonymous, along with a small group of women who had family members affected by alcoholism. This group offers a supportive community for those who are dealing with the emotional, psychological, and practical challenges that come with having a loved one with alcohol addiction. Um, so there are many different group therapies that have to do with alcohol and drug addiction. Um, I want to go over an intervention, like medication management can be considered an intervention for substance use and misuse. So some of those medications include anabuse, which is what happens is basically it's a blocker that if you take the medication, and if you drink while using this medication, you will vomit and throw up, and it's basically just helping you. It's a deterrent for alcohol use. And then we have naltrexone, and that naltrexone blocks the pleasurable effects of alcohol and reduces cravings by acting on the brain's reward system. So the purpose is to help reduce the urge to drink and can be used to support long-term sobriety after detox. There's also opioid use medications like methadone, and methadone is a long-acting opioid agonist, meaning that it activates the same opioid receptors in the brain as heroin or prescription painkillers, but without producing the same intense high. Um, it helps reduce cravings and withdrawal symptoms in people addicted to opioids, and is often used in a medically supervised opioid treatment program. And then we also have Suboxone for opioid use. It is a partial opioid agonist, meaning that it activates opioid receptors but is much lesser to a much lesser degree than full agonists like heroin. It can also block the effects of other opioids. So, I mean, it's kind of a controversial thing, Suboxone and methadone, because people, it's like using heroin just to a lower degree, or an opioid. And people typically can get addicted to those as well. So it's not the greatest intervention, but people do use it. All right, I want to talk quickly about harm reduction versus abstinence, because I think it's important to let you guys know all of the different interventions, because not everything fits for it. Not everything is fit for one end or fits everybody, right? So harm reduction is a public health approach that focuses on minimizing the negative consequences of substance use rather than requiring complete abstinence. The goal is to reduce harm, improve the quality of life, and promote safer behaviors while respecting the autonomy of the individual. Harm reduction does not necessarily require individuals to stop using substances, but encourages safer practices and overall health. So this would be like giving clean needles to an IV drug user so they don't get an infection. I mean, they continue to use, but they're utilizing safer practices than what they originally were. So abstinence is, in contrast, is a more traditional and often stricter approach to addiction treatment. It emphasizes complete abstinence of the substance use. The goal of abstinence is for individuals to stop using substances altogether, and it is often based off the belief that recovery requires total avoidance of the substance. Typically, this is the one you're going to see, I would say. I believe in abstinence. Some counselors don't. Some people do. I mean, it's up to the individual that's experiencing the addiction at the end of the day, and the negative consequences that they're experiencing. So the continuum of, I mean, we have to talk a little bit about continuing care, because once you stop using and have a little bit of recovery time, that doesn't mean you stop going to services and you don't use therapy or substance use counseling anymore. Right? Like, I like to say, like, if you had a breast cancer and you went to the doctor and you did radiation, all of the things, and now you are in remission, you don't stop going to the cancer doctor because you don't have cancer anymore, right? You want to continuously check in and make sure that things are good and that you're on the right path. The same thing with substance use, right? Yes, you stopped using, but it's important that you keep going to your counselor or your therapist, whoever it is, so that you can um, continue to make sure that you're going down the right path and that you have the support you need. That's kind of what continuing care is. Sometimes we offer it as in addition to our IOP groups. So it's something, once they complete IOP, they go to continuing care and then continue to see their therapist for individual appointments. Okay, so right here, this is just a quick snippet of what the 12 steps are for the AA program. If you want to read through them, you go ahead. Where I think just the most important one in my in my experience is step one, right? We're admitting that we're powerless over alcohol and that our lives have become unmanageable due to substance use. Okay, quickly, we'll go over the stages of change. This is important because um, this is kind of how you're going to determine where somebody is at with wanting to recover and be in recovery. We start with pre-contemplation. So this is the stage where they're not considering change and may not recognize that they even have a problem. They may be defensive or in denial or unaware of the negative consequences in their behavior. You see this a lot. That I think that a lot of people that come into DUI classes that are referred to get a substance use evaluation because of a DUI or a first time DUI, they typically think that they don't have a problem. They're in denial. I shouldn't be here. That kind of thing. That's pre-contemplation. Um, so contemplation. These are people that they're recognizing that they have a problem and are beginning to consider making a change. But they are not yet committed to taking actions. They may have mixed feelings about quitting, such as weighing their pros and cons of change. Okay, then we have preparation. So these are individuals that are ready to make a change. They're motivated and may begin to take small steps towards quitting or changing their behavior. They have made a decision to take action and are planning how to do so. Our next is action. So in the action stage, individuals are actively making changes to their substance use behavior. They are working hard to modify their lifestyle. They stop using substances and maintain their commitment to recovery. And then we have maintenance. The maintenance stage focuses on maintaining the changes made during the action stage and preventing relapse. Individuals in this stage have sustained their sobriety for a period of time, usually 6 months or more, and are working on integrating healthy behaviors into their lives long term. And then relapse, people go back and forth with the relapse on whether it's in the cycle of change or not. It says here that it's optional. You, believe what you want, right? I haven't really made up my mind on if I believe that it's a part of the cycle or not, right? I've known people that have been in recovery for 30 years, that they haven't used for 30 years. I've known some people that relapse after 10 years. I don't know. You come up with your own opinion about the relapse being a part of the stages of change. But relapse is a common part of the recovery process and it can occur in any stage. Relapse does not mean failure, but rather an opportunity to learn and try again. Individuals may return to substance use for various reasons, such as stress triggers or lack of support. Okay, last but not least, I just want to go over, well, I guess we got one more slide after this, but these are going to be lived experiences, okay? After the link, I put what the video is mainly about, right? So these are, like I said earlier, this is a guy who interviews people on Skid Row for a living. He asks them the hard questions and whatnot. They're very, I just like I want you to read the content warning, because there is descriptions of abuse, pornography, addiction, drug use, sexual content, visual caution, and descriptive stories, right? So these are people telling their stories, and typically people that are addicted to drugs. Okay, so they are sometimes in their worst spots they've ever been, and it's caught on camera here. So if you wish to watch these are lived experiences. I have seen most of these videos. I think they're a good learning opportunity, and for you to really see what it looks like when addiction gets to its worst. So if you want to watch those, you go ahead and do that. um, I think that they're good learning experiences. Okay, last but not least, the resources. So I am kind of an old school believer with addiction and recovery, right? So I've read the Alcoholic Anonymous book. This is called the Big Book, right? This is all the 12 steps. It has Bill W.'s some of his life story in it, and that kind of thing. It's a good book to read if you ever want to be a substance use counselor or are interested in how this all developed. It does have it's not easy to read, I'll tell you that. It's kind of it uses old language sometimes, but it's a good book. And then I love the movie My Name is Bill W. That is Bill Wilson's, the creator of AA's life story. It's on, I think, Amazon Prime. And then there's another movie, When Love Is Not Enough. This is about his wife and her creation of the Al-Anon groups, and her experience with Bill W. when he was in his active addiction. Therapist.aid, that has a lot of worksheets that you can use for IOP groups and things like that. We utilize a lot of the worksheets and activities on that website. And then Father Martin videos. They're old videos, but they are good videos. He is a pastor that lectures on all 12 steps of recovery and different parts of recovery, like when the family's involved, values of recovery, that kind of thing. They're good videos to watch for educational purposes. And then always the NADAC. This is where there's a lot of free webinars on there. I watched a lot of them before taking my substance use tests. I think that it's a great website that offers a lot of educational resources. It stands for the Association for Addiction Professionals. So if you want more information on anything addiction related, that's the website I would go to.